Okay, for Cody's test, the doctor is going to take the patient's arm and with a little bit of traction, bringing it up and then placing it on top of the patient's head. And then I will ask the patient, can you repeat that action? And how does that feel? The second motion should, if there's any pain at all, it should be painful no matter which direction it goes. The test will be performed bilaterally, so the doctor would take and perform the test a second time. Distraction test. This is designed to relieve pressure. So if the patient's complaining of cervical pain, then you're going to grasp. Best way is to go ahead and grasp the mastoid process and then distract the head. And then the test is going to be a midline test. Extension compression. You're going to bring the head into extension, and then you're going to go ahead and you want to bring your elbows up in front of the clavicles so you get a good line of drive, and you're going to press forward. This is going to be a midline test. Flexion compression. You're going to ask the patient to go ahead and flex their neck. You want your elbows to be behind the shoulders, and you're going to compress to have the correct line of drive, and this is a midline test. Okay, for animal compression, you're going to go ahead and place your hands directly on top of the head with the head in a neutral position, applying direct superior to inferior pressure, and you're looking for any kind of pain at that point, and this is a midline test. In compression, I'm going to have the patient go ahead and laterally flex to one way, bring my hands into that direction of drive, and compress. And I'm going to also do it on the other direction and compress. The pain I'm looking for is going to be on the side of lateral flexion. Any pain on the opposite side is generally going to be muscular, and you're looking for a nervous pressure, and so the test is going to be done bilaterally. Okay, for maximal foraminal compression, I'm going to have the patient laterally flex to one side, look at that shoulder that you flex to, and then look up at the ceiling. And this is a bilateral test. For Donahue's maneuver, what I'm going to have the patient do is flex their neck, extend, rotate to the left and to the right, and then lateral flexion in both directions. I'm going to then take the patient through those ranges of motion and try to add a little bit more in the passive. The patient should be able to be equal to or greater than in passive range of motion. If I don't achieve that, then I'm going to suspect a malinger, and this is a bilateral and midline test. On rust sign, I'm going to have the patient lay down, supine, and then I'm going to ask the patient to go ahead and lift their head. If the patient is not able to do this, or they don't use their hand when they complain of cervical problems, then I'm going to suspect a malinger. This is a midline test. Shoulder depression test. I'm going to simply laterally flex the patient's head. I'm going to use my, this hand as a support hand. I'm not going to add any pressure. I'm going to add pressure straight down on the shoulder. I'm looking for any pain other than the stretching of the muscles, and this is a bilateral test. Okay, go ahead and lie down supine. This is Soto Hall. I'm going to ask the patient to place their hand on their chest. I'm going to then place my hand directly over. Go ahead and lift your head slightly, and then I'm going to bring the patient's head as far up as I can. I'm looking to see if there's any pain down to the level of T7, and this is a midline test. Okay, cervical percussion test. You're going to have your grease pencil. You're going to make marks on each cervical from C2 down to C7. You're going to tap on each spinous process, and then you're going to move out 1 inch lateral to each of those marks. You're going to tap in a homologous fashion, first on the one side, then the other, then drop down to the next transverse process on that same side, and then move back and forth in that fashion. This is a midline and bilateral test. Sperling's test, we're going to go ahead and laterally flex the patient's head, ask them to look at this shoulder, place your hand on the head, and then go ahead and strike the top of your hand. This is going to be a bilateral test. Valsalva maneuver, I'm going to ask the patient to go ahead and place their thumb in their mouth and trying to blow their thumb out of the mouth, bearing down, creating as much intrathecal pressure down in their lower lumbar. And that is a midline test.